Honorable Charlene So,
I'm present.
thank you very much. Honorable Daniel E. So,
I'm here.
thank you, sir. Honorable Edison J. Wanika,
Here.
thank you, sir. Chair of 6 members, all present, constitute a quorum.
Okay, thank you. Um, Committee members. At this point in time, I get a call on West Chair on the call brigade to provide us indication for the work this morning.
Okay, thank you. Good morning. Yeah, Bennett, Chair, Vice Chair, Chanel, members of the Health, Education, Human Services Committee and our staff, and all those that are joining us today for this meeting. Ko ashiya atsugo kotedo sodazento otla iba ini tligo ibn nachiya kotego nanshil ko ishin binige iya ko ya nada di nisto nada iti kato ibike ho iya corona so sahalengi etatilni et igen lini sheha di benebi konde Njango iya nature hana ot njango hati li kreda ado iya ta konde iya binige halon ko iya hinani kai ko etla sala ho zange chair so ado iya honorable delegate Edison Waninka ado staff ko ado iya sa iya o pesh behana agi ye iya ikita be ye ikita hodil ko ba hi ni tsin ko kodoshin ya hanegi do sa te be ya ti ki ko ben ka ti lo aron sa kisi hat ishin ya banda ti inclida son kilish jan di lito jon go ya kilke di ki aro ya a kuch ya bana I kan ti sa ya te gi e de chuni ingo sa kisi at e Halan kitne iya bait ado iya anit lo iya anit iya tikon ni wanda hallo sabin bisin bistahni nani da hallo do kharchin da hallo ko sai khota da istan ko sado ya te jo ingo ko da baski ike da ha do ko da te da ko I aba ko ni zindo le ko te go iya sadiki iya basi kito lesto ego ichu I bonjon go iya and hit never need inston ibana ikon ado here di konta tan zaden hit nada isje kochen di nan shil ingibel nacho ko di sa is sotono shin hiat eo jon go iya ni wanden kharchen wan di khato ibana di khat Aroida sub nebe pasodils and konde na ahjana stagi kontra sonde aron dit khadan sun libaran khadna sun libetna has ago nes na diro anes na ene lago da anstango kon keya mis anigi konta inish ish aro kinda ja da do yigo ida inish zel ido ado al khada da salad da Arson خبصون لون طالع أرسل يأتي عن جنبه هم نأدي نشجي داي لا طالع سكو أدو يد أو هيو أني تندي با كونيت سنتيشين أتي دو يأتي هم سلسلة أتي دناشني نجي بنينا إذا داشنبو أتاهو يارو ليس أرو يأتا كونيت سنتولي كون بين هجي يأتي جي خدا دا خليان تنجي ashonde iya benachta ato sajle iya ahna hago shinda to tleside do inati ti sila do ni tranado nado tlesa ti hot ai in ye so ti to fast in din aro do higin edo yoni nini kwasin do higi ne tra bedni te tra bekita ni do chopata za kon hata ho wan go yinni sa la ikna has tran ko ashon I konto بالتعود زيجيل بتجيله نخل بتديل تشليش بن بيجي كون ينيك دا خاجي دا سكي سكيدا دا تلقي هت إيجو إيان خبا خليه دا صو أو شيء دا بلي دون سنجي ناس خجدا صو بسطيل هذا يدي كون دهن أبجد نه دشيش بخاطر خبيئة نه دشيش عشان جنبه إياه نحن بدو تشيلو إبن نشأية جين تيجو هاد إيجون جنبه تشيل هذا جهته تكون خالون دول لا تحتيب جاشي بني نام دهت ليه هي يسير فكسر بيزن تكون ليني تكوبي إنان ليني إيدي يسير بكسر بيزن بديشين إيد أتيدا كتر هذا يدا تصوفي وأنا هذا أنقو جان داز تين داز ثم خالون قو إنسان شجدات إيه شيان دات إيه تو دات إيه النأ بلاش لا إني ليني نحكها النأ هارونا توشين هي هلوني دات ثم خ بتجي هلون دول تو دات ثم بيدا إنايل إنجي دو لين إنجي دو دات ثم خ نخبا في اليادو أنصب أيدي بندي إشهاد أنصب من خندن لا دول إشهاد نيجيوت أيجي بس بيجي بالنسبة Amen.
And yes, to check my KB. We acknowledge the Creator, the giver of all life. I should have other committee members, thank you for calling in, and again, the items that committee members, are there any announcements? Follow-up request from Dr. Brensler about a work session. The other is a request to meet with the New Mexico Public Education Department and to meet the new secretary. Preliminary date listed is November 18th, 5 p.m. And that was the request for a face-to-face meeting in Santa Fe, New Mexico. We will also, if the committee wishes to maintain that schedule, and we will respond and confirm with that. That would be the thoughts as we move forward tonight. With that, we'll go to item number 2, recognize guests and visiting officials. So the folks on the call, please identify yourselves.
The chair is Lona.
Oh, it's not us, Honorable Bologna.
Okay, Ben. Chair, we can barely hear you on this side here over the phone there.
You'll have to also up your on your side too.
Yeah, I got my volume at full blast.
So, hey, now you sound louder than the last time. Are you saying repeat what I said?
Well, I don't think anybody heard you there, but I barely caught what you said there, Chair.
Okay. Looking at a work session with Dr. Renser and Division of Behavioral and Mental Health Services regarding agreements with the 3 states regarding, and each of them is requesting a waiver of, limited waiver of sovereign immunity. And that work session would entail attorneys with Navajo Department of Justice as well as our Office of Legislative Counsel and the staff of with Dr. Renser. The other is we had forwarded the request to meet with New Mexico Public Education Department Secretary, Assistant Secretary, and Assistant Secretary for Indian Education, as well as Indian Affairs Department Secretary. And the preliminary date has been set for November 18, 3 to 5 p.m. in Santa Fe. A face-to-face meeting was requested by the HES committee. If that, and the committee can vote on it at the end of the agenda, that would be the main announcement. So we'll go to recognizing guests and visiting officials.
Good morning, Chair and members of the Health, Education, and Human Services Committee. This is Jordan Edsity with the BOSBA.
Good morning, Honorable Chair So and House Committee. This is Tommy Sosi from Speaker's Office on the line.
Good morning, Chair and committee members. This is Rosita Kelly from Navajo Election Administration.
Good morning, Chair, committee members. This is Michelle Morris with Department of Health. Good morning.
Good morning. Yate Penishant Doshana Ado Health Committee. This is Melvin Harrison with LDA for Honorable Carl Slater and Chair for the Gimbos. Thank you.
Good morning, Chair and committee members. This is Regina Yazzie with Department of Family Service.
Good morning, Chair and committee members. This is Marlinda Littleman, Deputy Division Director with Division of Social Services.
Anybody else?
Good morning, everyone. My name is Rayama Tiba. I am the Senior Program Project Specialist for Navajo Family Assistance Services under Division of Social Services.
Good morning, everyone. My name
Good
is
morning, Chairman So. This is Pat Donnie, Acting Superintendent from Department of Diné Education.
Good morning, members of the committee. This is Rose Graham with the Scholarship Office.
Anybody else?
Good morning. My name is Trudy Sosi. I'm calling with the Northern Treehouse Shelter in Shiprock, New Mexico, under the Navajo Nation Division of Social Services.
Yes. Hello? Is that Honorable Alona?
Chair, good morning.
Oh,
This is Edmund Yazzie calling from Coolidge, New Mexico. I have a report under your agenda and the committee's agenda. I'll be on call. Okay, Bennett.
oh, yeah, case it's Shay.
Yad Epen. This is Yvonne Keeblison with the Navajo Area Office, IHS. Yad E Nostro.
Yate. Oh, okay, go ahead.
Yate Binishananta, Leonard Chi with IHS. Thank you.
Okay, who else? Thank you, everybody, for calling in. Okay. With that, if there's nobody else that wants to be recognized, Miss Angelita Benali, we'll go to item number 3, reviewing and adopting the agenda.
Yes, Mr. Chair, good morning. You have your proposed agenda for the Health, Education, and Human Services Committee, 24th Navajo Nation Council, regular meeting, November 10th, 2021. Presiding, the Honorable Daniel Iso, Chairperson, Honorable Carl R. Slater, Vice Chairperson. The place is the via telecommunications, Window Rock, Navajo Nation, Arizona. 1, call meeting to order, roll call, invocation, announcements. 2, recognize guests and visiting officials. 3, review and adopt the agenda. 4, review and adopt the journals. 5, receive report. A is an update regarding the UNM higher education developments. And the presenters are Ms. Patricia Ghani, Acting Superintendent of Schools with Doty, and Ms. Rose Graham, Director of the Office of the Navajo Nation Scholarship and Financial Assistance. B, the Navajo Nation vaccination strategy for 5 to 11-year-olds individuals. Presenters is Rosin So, Navajo Area IHS Director, Dr. Jill Jim, Director of Navajo Department of Health, and Patricia Ghani, Acting Superintendent of Schools with Doty. C, the Alcohol Treatment Center at Wells Springs Recovery, Rehoboth Hospital. Presenter is Council Delegate Edmund Yazzie, and Wanda D. Johnson, New Mexico State Representative, District 5. D is an informational and an update from Family Harmony. It's a domestic violence shelter in Shiprock, New Mexico. Presenter is Trudy Sosi, the principal victim advocate for Northern Treehouse Shelter under the Navajo Nation Department of Family Violence with the Division of Social Services. E is a report update, Family Assistance Services, COVID Funeral Assistance, Administrative Programmatic Issues. Presenter is Regina Yazzie, Department Manager 3, Department of Family Services. Deanna Neswick-Gishi, Executive Director, Division of Social Services. F, update notice to the Winter Rock District Court regarding WR-CV-55-20 regarding the completion of notice filed to the Winter Rock District Court. Presenters are Louis Millett, attorney with the litigation unit with Navajo DOJ, Harrison Rice, attorney with the Human Services and Government unit with Navajo DOJ, and Desiree Deschini, attorney in the Human Services and Government unit with Navajo DOJ. Business. A is legislation number 0195-21. B is to schedule a meeting request with Dr. Kurt Steinhaus, New Mexico Secretary of Education, with the New Mexico Public Education Department and the New Mexico, also along with the New Mexico Indian Education Division. C is to reschedule a meeting with the Tisnasmas Community School, a BIE school. 8, close a meeting, announcements, and adjournment. Mr. Chair.
Thank you, Ms. Benali. Committee members?
Motion, Halona.
Motion by Honorable Halona, second by Honorable Paul Begay. Any discussion? Going once, going twice. Okay. Mr. Mose, roll call vote, please.
Yes, sir. Honorable Paul Begay Jr. Present. Honorable Paul Begay Jr. votes green. Honorable Pernell Halona. Honorable Pernell Halona votes green. Honorable Carl Russell Slater.
Green.
Honorable Carl Russell Slater votes green. Honorable Charlene So.
I vote green.
Charlene So votes green. Honorable Edison Dewanika. Green. Honorable Edison Dewanika votes green. Chair, a vote of 5 in favor, 0 opposed.
Thank you. Committee members. So we'll go on 5 in favor, 0 opposed, chair not voting. We'll go to item number 4, review and adopt the journals. There being none, we'll proceed to item 5, receiving report. A, update regarding the UNM higher education development. Ms. Patricia Donnie and Ms. Rose Graham, you have the teleconference floor.
Chairman So. Good morning, members of Health, Education, Human Services Committee. Pat Ghani, Acting Superintendent, Department of the Net Education. Higher Education Impact Report. Rose Graham, Program Manager from Office of Navajo Nation, Financial Aid and Scholarship Office. Asian Kodo Nha Sohigi Kodo Bahui Net Ole Ako Esteya Adon and Schlinigi Eya Tnajini Nishnido Ashin Bashish Chain Ado Tachini Dashichedo Todachini Dashinale Hata San Nishne. I also wanted to allow some time to have Ms. Graham introduce herself too. Ms. Graham?
Yate, members of the committee, Rose Grant here with the Navajo Nation Scholarship Office. Thank you.
Ms. Graham, let me go ahead and yield this time to you to provide information as requested by HES committee members. Thank you.
Yate, members of the committee, can you hear me? Okay. The issues, I'll go by the information that are listed on your agenda. Meeting the professional demands of the Navajo Nation. If I could receive more definite about that in that line, then I can give more insight. UNM programmatic support for Navajo student academic success. I think that might be a question to UNM. And then there's the data that's being requested. And we do have some data. I will send that to you. I didn't get a chance to. I was trying to finish up a report so I can give you a report before this meeting. And the information that I gave to and is in a prior committee meeting when we were on the agenda, is related to, there was an issue on the agenda about developments related to higher education with UNM. And the I was Mrs. Ghani and I had a meeting with Dean Burley, who is the new dean of the college the College of Education. And they asked us how we needed, what we needed some help with. And the immediate issue that we have right now is the immediate issue that we have is we were talking about the learning loss in K-12 education, and that's still under development. The assistant dean just sent us a message this week, and we haven't set up a time yet, but we're going to have a meeting. And so they're working on Dean Burley said they were going to put a proposal together on how UNM College of Education can provide professional development to our schools. And so we're waiting. That's still under development right now. And that's where we're at with that. And that's where we would, and this all goes in the plans with ARPA funds. We are going to submit a proposal. It's about $7 million. And those are some of the areas that we're going to be targeting. We won't be having just, like general distribution to everyone that's in school. It'll be targeted towards the needs of our students based on how we're mitigating COVID. And a lot of our students, I understand, in the K-12 have missed a lot throughout the past 2 years. So what we would do is provide funding to the educators, not to the educators, but through UNM, so they can get professional development and helping our students catch up is the plan. So, and there are other related plans in development, and we're in the very early stages. So, and it's going to require some more definite agreements and documentation. So
They can pick us up here.
still putting
Okay, pick us
that.
up. Pick you over here. Oh, yeah.
So that's where we're at. We are not ready to provide definite plans yet. We also need to put some data.
Okay, it's gonna be off of Highway 491.
Excuse me, I'm in committee meeting. I'm supposed to be reporting. I hear somebody talking. So that's the extent of my report, Mr. Chair and members of the committee.
Thank you, Ms. Grant. Honorable Halona, you're the only one that's close to 491. Could you mute your phone? Thank you, Ms. Grant. Appreciate the brief report. I guess the other part is in last week's presentation about the executive order from the White House, NTU and the Net College also talk about working with the school systems on learning loss. Is there going to be an outreach, or is by the department? And is this something that the committee should continue to coordinate? Addressing learning loss, again, also to incorporate some of the higher institutions, both on the Navajo Nation, as well as the higher institutions, the tribal colleges, where there are high numbers of Navajo students. Mississippi and IAIA. And of course, that, and then, other post-secondary schools, Fort Lewis College, NAU, U of A, ASU. So those, is that something that the committee needs to take on ourselves? And with, again, that would be something that we would have to discuss with Office Legislative Services as well as Office of Legislative Counsel. Ms. Grant.
Mr. Chair and members of the committee, yes, we have majority of our students are in the Four Corners area. So, and we have a lot of partners in various fields. It's not, education is one field. We have also gonna concentrate on the health fields. So we intend on reaching out to where majority of our students are. And of course, Dana College on NTU are, that's where our schools are. That's where the majority of our concentration will be. And so we are talking, we're not, we need to put some concrete plans together. So, and we have a lot of coordination going on other ARPA initiatives. So, but we will, we intend on working with all the schools in the area where majority of our students are at. Thank you.
Thank you, Ms. Graham. Committee members, do you have any questions? Committee members, going once? Going twice? Regarding this this report, the committee wants to address it. Honorable Edison Wanika motions to accept the report. Committee members, do I hear a second? Do I hear a second?
Chair, I second.
Thank you. Supervisor. Okay. Second by Honorable Charlene Cove. Do we have any questions, further discussion, committee members? So I guess going forward, committee members, we will then turn our focus to the other institutions to be part of the discussion on learning loss, and then how do we address having students, go into, education, teacher education, as well as Ms. Rose Graham talked about, how do we also get Navajo students to go into the healthcare profession. Those are some items that we will continue to address. Committee members, any other discussion? If not, then Mr. Mose, roll call vote, please.
Yes, sir. Honorable Paul Begay Jr. Green. Honorable Paul Begay Jr. votes green. Honorable Pernell Halona. Honorable Pernell Halona. Honorable Carl Russell Slater.
Green.
Honorable Carl Russell Slater votes green. Honorable Charlotte So.
Green.
Honorable Charlotte So votes green. Honorable Edison J. Wanika. Green. Honorable Edison J. Wanika votes green. Honorable Pernell Halona.
Green.
Honorable Pernell Halona votes green. Chair, a vote of 5 in favor, 0 opposed.
Thank you. Committee members, 5 in favor, 0 opposed, and the chair not voting. Once we get to the end of the agenda where we talk about upcoming work sessions, we may do a tour of the, and we'll discuss it more as we move forward on how to best approach this aspect of getting more students into the specific education and healthcare degree programs. With that, we go to item 5B, Navajo Nation vaccination strategy for 5 to 11-year-old Navajo individuals. The presenters will be Ms. Roglinso and Dr. Jill Jim, possibly Ms. Patricia Grani. I got a text from Ms. Grani that she's on the road to Albuquerque and may not have telephone service. Let the record show that in the BNF conference room we have Honorable Edison Wanika, Honorable Paul Begay, and Honorable Carl Slater, and myself, as well as legislative staff, recorder, Mr. Leonard Lowe. So, Ms. Roseland, so we have the teleconference floor.
Hi, good morning, Chairman So. This is Mark Isyazi with the Office of Indian Self-Determination. I don't see Ms. So online, so I'm messaging her as well as Dr. Jim and Dr. Va, who will be the individuals who will be giving the presentation today. Thanks.
Thank you, Mr. Yazzie. Dr. Bob, are you on the call?
Yes, hi, this is Dr. Va. Do you hear me okay?
Loud and clear. Thank you. You sound all energetic to report to the committee.
Well, thank you. It must be the coffee. Yes, and so it's my understanding that we can provide some updates about pediatric vaccines. And so let me go ahead and do that. As of last week, the FDA, the CDC, and of course adopted then by IHS, had approved the Pfizer COVID-19 vaccines for those that are 5 to 11 years old. And so that was extremely exciting. Prior to all of this, our point of contact at area office had been working very closely with sites in regards to the planning and distribution and administration of pediatric vaccines to all participating sites. The sites are all the same sites that were participating before. So most of the sites, with the exception of Utah Navajo, who are getting their doses from the state of Utah. And so with that being said, they had clear instructions that there will be 3 waves in regards to distribution of the pediatric vaccines. And sites were receiving it no later than 9 days after the EUA approval. And so some of the earlier sites started to receive it as early as last week immediately. And there was a soft launch of those vaccines that were then administered to pediatric, to kids ages 5 to 11 years old. And so some of the updates on planning. Facilities and service areas have been working very closely with schools, with the community, and creating events targeting this age group. And the soft launch was last week, and I believe between last week, this week, all the way leading up to like the holidays, there are multiple events in the community and at schools to reach this population. There are some, based on our vaccine data, we start to see just that. We actually start to see those ages 5 to 11 receive their vaccines in the hundreds. And so that's reassuring, and that was just the soft launch. And so I'm anticipating those numbers are going to grow this week, next week, in the several, I guess, in the upcoming weeks, leading up to Thanksgiving and into the holidays. And so we're really excited about that. Some just points. We are messaging that, the vaccines are safe and effective based on the reason why it was unanimously approved by CDC and the organization ACIP, the immunization organization, was because it was shown to be 90% effective in kids at preventing COVID-19. And the risk was very low in terms of side effects to anticipate. There was among the study participants, there were no cases of myocarditis, which was that inflammation of the heart. And with all the COVID vaccines, it continues to undergo some of the most intense safety monitoring system. And so we have been messaging that out to the public that this is indeed very safe, very effective for kids in this population. And we encourage the public to bring in their children. Are there any questions about that, about the pediatric doses?
Chair Solona?
Honorable Halona, yes, go ahead.
Thank you, Chair. Thank you, committee members and everybody on the line this morning. Real quick question, ma'am, about the preventing COVID-19 in children. Isn't it still, 100% preventable, or do some of the children, they can still catch COVID after they get the vaccine, but they won't get as ill or get sick? That's still possible? Is that correct? I just want to clarify that. Thank you.
Yeah, that is a fantastic question. And it's a very, very good question. Well, this is what we do know about the vaccines, just even in adults, right? We do understand that over time that the protection provided by the vaccine goes down. We do know that it is effective at preventing severe disease that lands people in the hospital and even potentially, results in death, right? But we do know that the protection wanes over time. And as a result, that's why we are encouraging boosters for all Navajo Nation residents 18 and older. Now for kids, what we currently know based on the data is that it's effective at preventing COVID-19 infection and at preventing severe illness. Very similar, similar findings in adults are are found in the children studies as well, is that the goal is to, even if it's not 100% effective at preventing COVID-19 infection, if you are vaccinated, it will still reduce your chances, or reduce the chances of children 5 to 11 years old of having severe COVID-19 disease, which we know comes with potential long-term consequences. And so it should prevent them, prevent severe disease and prevent death.
Sure. Honorable Vice Chair Carl Slater, you have the floor.
Thank you. My question is, are there unique factors in trying to do children, as young as 5? And I know it's been, barely a week now or what have you, but, adults are able to schedule themselves out 21 days from now and make time within their schedules. Or, you were talking about the community events that the service units are pursuing. In terms of this rollout, are there special considerations that you or IHS more broadly, the service units are taking into consideration? Because, these aren't fully formed adults who have full control over their lives, so they have school or other things. I guess, are we working with the schools right now to help get the vaccines out? I just want to hear more about that sort of rollout and what the strategy is, as opposed to just trying to get, adults through a drive-through.
Yes, we are. Hi, yes, and thank you for that question. We are working with schools, and so in the coming weeks, there are school events where we've coordinated with schools to make sure that, they're bringing a classroom at a time so that the students can get vaccinated, and so that is happening.
How are parents providing consent or the guardians doing things like that in this instance?
Yes, and so this is where the planning, it's really critical. And when we work with schools, we do put that out, where there are special considerations for this age group, of course. One of them is parental notification and parental consent. And so it does take some level of planning to make sure that when the event arrives, is as successful as possible. And that's what the public health teams and clinical teams and vaccine teams, I should say, when they do work with schools, all of that is planned prior to the event, to make sure that consent forms are distributed, that they are returned, and that we have an anticipation of how many students are scheduled for vaccines.
Committee members, any follow-up questions?
So, Che, this is Dr. Jim. I wanted to add some information.
Good morning.
Thank you for those comments, Dr. Va. I just wanted to iterate that we're trying to keep our Department of Health webpage updated with weekend vaccines on social media, and also the weekly vaccines are all updated. So we're gathering information constantly so we can support some of these efforts. I know we're working with the donation funds too, trying to get some turkey and ham out to families that are going to the drive. So we're working on getting those PRs situated to get vaccines, or to support vaccine uptake as well. There is a new percentage that will probably change. We put the percentages of our vaccine rates on the Department of Health webpage for 12 years and older, which is at for 12 years and older is 70%, and then the entire population, including those that are not eligible for a vaccine, I think we're at 57%. And for us to increase in going to a percent, I know we've been saying 57%, and we're a very large population, and we also now understand that it's harder to get individuals to receive their vaccine, let it be families or or children. We seem to have hit a plateau. So in order to even, we're anticipating if from last week from the November 2nd to November 8th, I think we had close to 500 people get fully vaccinated. So that's a lot of people. And to do that for that duration of time, I hope we can move up 1% in the next couple of weeks, but now we're going to also include the little kiddos that are between 5 and 11, and we'll have sort of that data available. And then I don't know, while I'm talking, maybe Dr. Vaught can share how many 5 to 11-year-olds we have that would need to be vaccinated, and we'll be monitoring those numbers as well. But we still have a lot of work to do with vaccine efforts. So, and also we are experiencing a high number of cases. We're in red all across. We're carefully monitoring hospitalizations right now, and we'll be monitoring those throughout the week and into next week. And if we continue to see our hospitals impacted, eventually we'll be making decisions on new public health emergency orders early on next week. So really need to get the kids vaccinated. And I believe from the DOTI, they're probably working with the information that we're providing to the school, to the public regarding vaccine events. And so the rush is that we need to get people vaccinated before the holidays start. They won't be fully vaccinated, but at least they're partially vaccinated. And with the increasing rates, it is a concern, and vaccines do work. So I appreciate the time for you to invite us to the call, but that's where we're at. I know I went off a little bit off the vaccine rate, but I also wanted to give a brief update on the status of the high transmissions of COVID across the Navajo Nation.
Thank you, Dr. Jill Jim. Committee members, question, comment? Dr. Va, the pediatric vaccine, thank you for using your medical terminology. Otherwise, we would have kept saying 5 to 11-year-olds. The pediatric vaccine, is it available in Pfizer, Moderna, and Johnson & Johnson? And will it be a 2-dose vaccine?
Hi, yes, you're right. Pediatric vaccines, those that are 5 to 11 years old. And so right now it's only available for the Pfizer vaccine. And this, a common question that we're receiving is this vaccine different than the adolescent and adult vaccine? It is. It has the same active ingredient, but the dose is much smaller. It's 1/3 of the adult dose, and it was designed specifically for kids 5 to 11 years old. So right now it's only available in Pfizer. It's not available under Moderna or Johnson & Johnson, although I know those studies are still underway. So it's only Pfizer. It is a 2-dose series. And so kids are getting vaccinated now, and then they have to wait 21 days to get their second dose.
Thank you. And I guess the main thing you also mentioned in your presentation, Dr. Vaught, could you share a schedule where you're coordinating with the schools, whether they be the public school district, the Navajo Nation contract and grant schools, and the Bureau of Indian Education schools? And you stated that there will be a school event. And And we know that, you also made reference to the parental consent. Are those forms going to be available online so that parents can basically have it ready when the event comes to their school? Dr. Voss.
Yes, that is a great point. Right now, I'll let Dr. Jim I'll let Dr. Jim also speak to this. Sites are being asked to share their events with HCOC and Dr. Jim and her team so that we can put it all on the public website so that everyone can see the events that are occurring. And I like your idea of having parental consent already on that site so that they can just print it out and sign it. So that's a good idea. Dr. Jim, did you want to add to that?
Yeah, thanks, Dr. Bott. Well, each facility is different. We have over 8 service units. We have facilities in New Mexico, Arizona, and Utah, and they all have different forms that they're working with the schools on. So I don't know if that can be all uploaded, but I would suggest that the school, if there are parents that do have questions, I think need to ask the school questions about accessing vaccine, if they're scheduling any vaccine events with the local health facility, depending on the size. And just as a reminder, we are very stretched then, I think, already responding to COVID, and also the same providers, and similarly, they're providing vaccinations. And we do have FEMA staff out there that are activated in assisting some of the hospitals right now with vaccine coordination, such as Tuba City and the TMC as well. So those requests are out. And then although we are encouraging everyone, there should be communication locally that's happening. So if there are questions, parents ought to ask the schools if they're doing that sort of coordination, because we also have asked the health facilities to make sure that they're communicating with each of the schools on how this can be done. And then I think the vaccine drives are the easiest accessible way to get a child vaccinated, and those are blasted through social media by the health facilities, by DOH as well, and through radio too, and through the town hall. So if parents are not receiving that information, my best advice right now is that parents should be able to ask their school on how they're if they are coordinating with the hospitals, and to get schedules from their local health facility, and that would be the better approach, because we don't have access to all of those in situations where we can get consent forms. So, but we can certainly bring that back up to the health facilities as we have to get that situated. So thanks.
Committee members, any other questions, comments? Okay. Chair is open to motion to accept the report.
Motion to accept the report.
Honorable Paul Legay motions to accept the report. Second by Honorable Mr. Monica his report.
You can't hear anything if you go.
Rather than Honorable Paul Legay, so those of us in the room, we have to go back to the form of raising our hand. Thank you, and we look forward to, I guess, again, how we'll have to look to Department of Education, reach out to the schools for their schedules, and then how do then we reach out to the public school district? So we'll put it on the administration, the executive branch's shoulders. To do that aspect. Committee members, if there's no other follow-up questions. Mr. Mose, roll call vote on the report.
Yes, sir. Honorable Paul Begay Jr.
Delegate Paul Begay votes green.
Honorable Paul Begay Jr. votes green. Honorable Pernell Halona.
Maloney votes green.
Pernell Halona votes green. Honorable Carl Russell Slater.
Green.
Honorable Carl Russell Slater votes green. Honorable Charlene So.
I vote green.
Honorable Charlene So votes green. Honorable Edison J. Renika. Honorable Edison J. Renika votes green. Chair, vote of 5 in favor, 0 opposed.
Thank you. Mr. Mose, 5 in favor, 0 opposed, chair not voting. Now we go to item 5C, Alcohol Treatment Center - Well Springs Recovery, Rehoboth Hospital. The presenters are Honorable Council Delegate Edmund Yazzie and Representative Wanda Johnson. Mr. Che, Honorable Edmund Yazzie, are you still with us?
Star 6.
Star 6.
Chair?
You have the floor, Mr. Che.
Okay, thank you. Also, committee members, this is Edmund Yazzie. I'm calling from my place, our place here in Coolidge, New Mexico, which is just about 10, 11 miles west of the roof between the Yambato. I just want to say, first of all, Chair and committee members, thank you for allowing me to speak on this matter. It's a very important matter, which is regarding alcohol treatment. As you know, it's very scarce among our area for treatment centers within the Navajo Nation. And I do understand we are trying to do the best that we can as far as council and as far as the executive to try to combat this problem with alcoholism. In Gallup, as you all know, the numbers are pretty high. And in Gallup, as you all know, that we do have our detox center. But we just feel that there's not enough areas that are out there to help our people who want to fight this disease. And I know the judges in Gallup and our tribal judges are trying to send individuals to centers, but they are very scarce right now. We don't have any, and if we do have any, we have to transport them out of town. And I've been meeting with Representative Johnson, and I hope she's online, and his staff, Teresa, Ms. Mahan. And so at this time, Chair, I would just would like to give them time to present to the committee on this report, and I want to let the committee members know too as well that we are planning to go before the Gallup City Council and then the county commissioners as well with this matter and with this report that's going to be heard this morning. So, Chair, at this time, Ms. Representative Johnson, are you on call? Is Teresa Mahan on call? Can you hear me, Chair?
We can hear you.
Okay. So, all right, looks like they're not on.
Riding solo.
It looks like they're not on call, Chair and committee members. Let's see here. Can I ask the staff if the brochures and was sent out to our colleagues?
Honorable Edmund Yazzie, we do have, the appraisal report.
Okay.
The appraisal
Okay. All right. Okay, so let me go ahead and try to, go ahead and talk about this more since our agents are not on.
Hello.
So, is this Representative Johnson?
Yes. Good morning.
Okay.
We were
Good
trying
morning.
to unmute ourselves.
Okay.
So we are here.
Okay, so look, Representative Johnson and Ms. Mahan, what I did is just did a brief introductory, and we'll go ahead and go into the presentation. So if it's okay, Chair, I'd like to give Representative Johnson the phone lines.
So,
Okay. Representative
Okay.
Johnson. Mhm.
Thank you. Good morning, Shinant Honorable Chairman So and Honorable Vice Chairman Slater and Honorable Health and Education Human Services Committee members Ado Shania Shatile, Council Delegate Honorable Edmund Yazzie. Shi'e Yahat Titna Jinin Shlonkia Ani Bashish Team Nanash Edtachi Ne Dashiche Lasche Dashanal Ado Yotore o Yehowanje Aje E Yaha Keya Shlapi Hahozoje Atashinanishe. This is my fourth term in the New Mexico State House of Representatives, and I represent House District 5, which includes East Gallup in McKinley County. I also represent communities in San Juan County. I represent 19 chapters in Eastern Navajo Agency. And I'd like to thank you for affording us this opportunity to present to you this morning. I am with my colleague or expert witness, Dr. Teresa Meehan, and I will have her introduce herself in a few minutes. Today, we come before you to talk about a proposed plan to maintain and expand the behavioral health services at the former Wellsprings Recovery Center, located in East Gallup at the first and original Rehoboth McKinley Christian Hospital. I think most of our parents were born in that hospital. So this is an urgent need, we think, for our Navajo people, our Native American community members, our Zuni neighbors, and people from all walks of life who struggle with substance abuse. And winter is approaching, and we are concerned about exposure fatalities among our people. And this was a facility that truly helped our Navajo people, a 90-day residential recovery program that offered counseling, traditional healing, some social services, and housing. So we would like to propose that the Navajo Nation consider purchasing or leasing the facilities to continue the program. And we did have we had a meeting with our Zuni governor and the city of Gallup. We had initial meetings, which we can also report on. But at this time, I would like to defer to my colleague, Dr. Teresa Meehan, and she will introduce herself and talk about the proposal. Thank you.
Thank you, Representative Johnson, honorable chairs and committee members. I would also like to repeat thank you for this opportunity to have this discussion today. Thank you, Council Delegate Yazzie, for helping us get to the table to have this discussion. I am the former program director for the Wellspring Recovery Center that is a part of RMCH. That facility was suspended. Services were suspended on June 4th of this year. The hospital has decided that due to some of their own financial constraints and other issues, that they cannot continue with the behavioral health program, which is really devastating to this community from our perspective. I'm now working closely with the CEO to try to find a new owner operator for the facility. I'm also here wearing a different hat as well. I'm a co-founder of an organization that is a nonprofit that could potentially help with some of this programming. And collectively, I've been working with Dr. Branzer with the Behavioral Health Division and some other folks to see if we can't bring this program back to fruition. The major concerns for the community, as you know, as Delegate Yazzie mentioned, there's a serious alcohol issue, substance use issue, and we have a number of community members who now, as the winter months are coming, are going to be seeking shelter. They're going to be seeking services. And although there are some programs in the area between NCI and the Four Corners program, they have a detox program, and they also have a small residential program with a maximum census of 19. Even so, that's only putting a small dent in the services that are really needed in this community. The advantage to the program that we had at Wellspring was that it was culturally appropriate and relevant. And we were really beginning to change programs in the direction to create a more holistic approach to treatment, to focus on the traumas that are the underlying cause of the substance use issues. And so it was devastating for us to have to suspend our services. But we're really hopeful, after having multiple conversations with tribal members from the Zuni Pueblo, but also the Navajo Nation, city council members, city manager, the mayor, and some county officials, that there is enough desire and the need is obvious in this community that we could get this program up and running again. And so we're really here to answer questions, but also to formally ask the Navajo Nation to consider purchasing the facility and some of the surrounding land and making it possible to reopen this program as a service of the Navajo Nation, but then open to, we were receiving clients referrals from all over the state. About 90% of the referrals in the last year were from the Navajo Nation, but we also received numerous referrals from surrounding pueblos and other entities throughout the state. We know that the social issues that are so prevalent are really almost to the level of being a public health crisis, even if they haven't been so declared at this point, between substance use, increases in domestic violence, and increases in suicide rates. We know that some of this increase is a result of COVID. Numerous people are going through tremendous amounts of grief and loss, and we don't have the programs in place to help folks. Although there's things there, it's just not enough. We're hopeful because there is funding coming down from the federal government. IHS just announced in the last week $46 million in funding for behavioral health programs. And we feel like if we could all work together and collaborate, we could really put a tremendous program together for the community and for the Navajo Nation. And so again, I'll repeat, our ask is really for this committee and for the tribal council to consider the purchase of the facility. And if you have any questions, we'd be happy to answer them the best we can.
Any questions?
Chair?
Honorable Edmund Yazzie.
Okay. Thank you, Chair. Thank you, Representative Johnson, and then also to Dr. Mayhem. Committee members, I would like to ask on this matter, if we, and asking the committee, if we can start up a like a campaign, and if we can have a meeting with our city councilors, our county commissioners, and possibly the Zuni tribe, and just to let them know that if with your approval and with the council's approval, that we're going to start up this issue regarding in purchasing the building for the alcohol treatment. In the past, committee members, especially in the Gallup area, like I indicated, there was the opportunity for judges and for any individuals that want to get treatment centers, they have the opportunity of sending people to local facilities. But now that's not the case. But I really believe, committee members, that if we can get the city of Gallup, the county, and the Zuni tribe, if we, and with the committee's directive, that we have a big, maybe a work session with all these proper, with the departments that I mentioned, we can have a good start in this. And so I'm asking the committee if we could do that as a directive. I know years ago we did this with the past Law and Order Committee. We had every department that was serving on the nation to be at a work session from the county and state level, and that was a success. And so with that idea, I'm asking the committee if we could do that to the departments I asked on this important matter. And I feel that they need to take part too as well, committee members. And so anyway, I'll just leave it at that. Chair, thank you for allowing us to present. I don't know if Representative Johnson wants to say any more, but or Dr. Mahan, but we go ahead and stand for questions. Chair and committee members, thank you.
Thank you, Delegate Yazzie. Chair had to step out for a moment, so I'm going to take over chairing the meeting. Committee members, do you have comments at this time, or I think Dr. Jim or DBHS is on the line, Dr. Branzer. Would you like to hear from them? Okay. Dr. Jim, are you and your managers on the line?
I'm sorry, Chair. This is Michelle with Department of Health. Dr. Jim had to step out for another meeting, but Dr. Branzer should be logging on pretty soon.
Okay. Committee members on the call, do you have any questions or comments at this time? Delegate Helena, Delegate So.
Vice Chair, Delegate Helena.
Okay, Delegate Helena, you recognized?
Thank you, Vice Chair and committee members. Thank you for that presentation, Delegate Yazzie and Representative Johnson. Good afternoon. I just want to express my support for this program. I think it's according to the statistics around the Navajo Nation and as far as McKinney County is concerned, there's a real high rate of alcoholism and death occurs from that. And yes, there's not enough programs around here to service every need there is out there. So I support this effort to get another program started, or restart this program. And that it's important, and I think there ought to be other ways to put the word out to the people out there that, you know, because it's younger people these days that you see out in the streets more than it is elderlies, and so that is a concern for me, that it's a problem. And how do we get them to wake up and not to be out there on the streets, especially young people? And so that would be another place where we need to have to conquer in order to make all these programs succeed. Thank you, Vice Chair. That's my comment.
Hi, good afternoon. This is Michelle. Oh, hello.
Oh, thank you, Michelle. I guess committee, should we go to Department of Health?
Yes.
Okay. We'll go back to the Department of Health to, I guess, provide whatever comments you can at this time.
Well, thank you. Yeah, good morning, members on the HES committee and Honorable So and Honorable Slater there, and also for Honorable Council Delegate Manyazi and Ms. Johnson as Dr. Meehan. So I just wanted to give a quick update to the Division of Behavioral Mental Health Services has been aware of this issue with the Wellsprings Recovery Center and their unfortunate closure earlier in the fall. And so we have met a couple times with Dr. Meehan and I believe their other director there too. And so we were looking at supporting and seeing how Navajo Nation, if it is an option to purchase a facility, how we can continue with those services for substance use, of course, and co-occurring disorders. And so I submitted a proposal to President and Dr. Jim. The last one's October 8th. And in there, it was mainly just looking at how, with the appraisal of the building, the viability of restarting. And Dr. Meehan did provide the last appraisal that was done. I think it's a bit old, but I think they were planning to do another one too. And so what we were looking at is being able to work with the state Medicaid system in New Mexico to help, you know, in a sense with revenue reimbursements for treatment services there. And so that's another area we were looking at within DBMHS, because we do see the need for restarting this facility because the need is so great, but then again, making it self-sustainable as well, and looking at the staffing patterns that would be needed there. The other part is, you know, it does have some land as well, and that there's 2 building structures, I believe, there as well in that appraisal. And looking again at operational costs, and again, how that could be offset with any possible billing revenue. And that again would be with the New Mexico Medicaid. And then also our other recommendation was again to see the past appraisal kind of be more updated. Otherwise, you know, it does have a lot of room for different levels of care. I think y'all have heard me speak about ASAM, or American Society of Addiction Medicine, and different levels of substance abuse treatment that are possible since the facility is large. and it would really meet a great need. So it could even house residential treatment services as well as outpatient treatment services, or more of a step down type treatment services after residential. So I just wanted to, let you know that those are some of our thoughts after we have toured the building, looking at the appraisal, making sure that it's, sustainable in that way, because it is a greatly needed in the area treatment facility. We just wanted to make sure that and how that would look as in a purchase, as well as the proposed operational costs and possible billing, so it can be sustainable. And that would be the end of my remarks. Thank you.
Thank you very much. Committee members, do you have questions or comments at this time? Going twice. Oh, Chairman So, recognized.
Philip, Honorable Vice Chair Carl Slater, thank you for presiding while I grab lunch. Che, Honorable Edmund Yazzie, Representative Wanda Johnson, Dr. Mahan. Seems like, and why did Rehoboth shut down the services? Are there the implications that you do have a report from the Gallup Fire Department? Was it shut down due to safety reasons? Was it the building operating costs too prohibitive for COVID McKinney County Hospital? And I guess the main thing is, since Rehoboth has included in their name McKinley County, how much money does McKinley County infuse to the operation? And part of the Wellsprings PowerPoint shows that there was quite a bit of money that's available from the state, and why couldn't Rehoboth continue running the facility? Presiding Chair.
Thank you very much, Chair. Are you directing that to Representative Johnson or to whom?
To all the presenters.
To all. Okay. Do any of the presenters want to tackle that first?
This is Dr. Meehan. We're having a little bit hard time hearing everything, but let me answer those questions as best I can. The hospital organization itself, aside from the treatment center, has been suffering from a lot of financial strain. Part of it was pre-COVID, but COVID didn't help matters. So it was to the point, this really isn't revealing anything. It's been in the newspapers, but to the point that the hospital was concerned that it wouldn't be able to make payroll. So it suspended the services at Wellspring, with every intention of trying to get it back open again, but not necessarily by them. That's thus the reason I have this position now, is to try to find a new owner operator to get it up and running again. The hospital has also terminated services at a couple of other clinics in an effort to become more financially stable. The safety issues, the report from the fire marshal, most of those things were addressed. There are some building needs that still need to be looked at. Dr. Branzer and some others have been over and have reviewed those. So they've got a pretty good picture of what the issues are with the building itself. When we were up and running, we did have a couple of incidents with clients bringing in contraband, which is fairly normal in a residential setting. It was dealt with the way that was effective, and it really didn't provide, or it wasn't a serious safety threat for anybody. Those things are going to happen in a residential setting. So that's not a reason for it to be suspended, but it really is the financial aspect from the hospital, which is the reason they made the decision to suspend the services. As far as the money goes, it was doing very well in and of itself. Originally, if I can explain kind of the reimbursement stuff, the facility for years was getting reimbursed. Everybody got reimbursed. Their services were reimbursed by the state. Medicaid was not involved because the facility wasn't accredited. And in August of 2020, we did achieve CARF accreditation, which is so important to be able to become a Medicaid provider. And we needed to make that transition because the state said that financially it didn't want to continue to foot the entire bill. So in the chart that you're looking at in the handout, it's really just showing what the revenue was. There's one that shows what the revenue was as the state reimbursements, just a flat reimbursement rate that happened to be per client per day. And then what it could be potentially with Medicaid reimbursement. And so that's what Dr. Branzer was referring to in terms of the sustainability in making that transition to be a Medicaid provider. And the other thing that happened was for the longest time, the facility was considered a 69-bed facility. And unfortunately, what happened was there were really just too many people to a room. It was not appropriate for the fire marshal. Individuals didn't have enough space. So realistically right now, the maximum census would be around 50. There's a lot of space in that building. There's a lot of potential to expand. But current space, if it were to open today, the census would be a 50-bed facility, not a 69-bed facility. There's a lower level floor that hasn't been used in years. It has potential, as Dr. Branzer mentioned, for possibly outpatient services so that we could provide the entire continuum of care, and then work collaboratively with other entities in the communities, whether they be in the city of Gallup or, on the Navajo Nation, to transition folks to outpatient services and community level services. I don't know if that answered all of the questions.
Thank you very much. Chair So, do you have any follow-up?
I guess, thank you, Vice Chair Snyder. As Honorable Edmund Yazzie, stated, we could, I guess the main thing is just the presentation and not really to make a decision today, but we could schedule a follow-up meeting with the county commission, the city council, and even the board of directors the Wellspring facility and the Rehoboth McKinley County Hospital board of directors. That would be my thoughts. Vice Chair Slater.
Okay. Would you like to, well, let me ask, committee members, is there any other follow-up?
Yad Ashanand, this is Representative Johnson. I just want to say that, I want to thank you again for affording us this opportunity. I do want to say that time is of the essence, and that I think this is a very, very important initiative for the Navajo Nation. I think it's a great opportunity for our Navajo Nation to purchase land, to purchase a facility, and to take the helm of a program that pertains specifically to our Navajo communities. So I hope that, we can continue to take great consideration. We have already met with the city mayor. We have met with the Zuni and the board. So, just want to encourage us to move along as quickly as possible. Thank you very much.
Thank you very much, Representative Johnson. Committee members, I think we had the beginning of a directive or something to include in the motion to accept the report from Chair Stowe. So at this time, the chair will entertain a motion to accept the report.
Motion to accept the report, though, if you get.
Is there a second?
I'll second Delegate So.
Chair recognizes the motion from Delegate Begay and a second from Delegate So. Chairman So, did you want to include anything in the draft for modification or anything?
Thank you, Vice Chair Slater. Committee members, I would ask that in accepting the report that we meet with the County Commission, Board of Directors of Rehoboth McKinley County Hospital, and even the Gallup City Commission. And going forward, I think the other aspect is we only have a one appraisal. As you know, I was on the council when we purchased Navajo Preparatory School. And in that aspect, there was the appraisal by the Women's Division of the United Methodist Church. At that time, the committee ordered a second appraisal. And I come from that experience. And part of that process is Navajo that required for 13 cents on the dollar of the appraised value. And I become skeptical when somebody says time is of the essence. It comes to the point it's been a long-standing issue that the facility was shut down, and we're just now hearing about months have gone by. So in that aspect, then the committee should be. Okay. Motioning parties, I request that we include those requests for follow-up meetings. Thank you. Vice Chair Slater.
Delegate Begay, do you consent?
Yes, I do consent.
Delegate So? Delegate So, is that a yes? I apologize.
Yes, I concur.
Okay, thank you. Committee members, any further discussion on agenda item C? Going twice. Mr. Bose, can you do a roll call vote on accepting the report?
Yes, sir. Honorable Paul Begay Jr.
Delegate Paul Begay votes green.
Honorable Paul Begay Jr. votes green. Honorable Pernell Halona.
No votes green.
Halona votes green. Honorable Charlene So.
I vote green.
Honorable Charlene So votes green. Honorable Daniel E. So.
Thank you. I vote green.
Honorable Daniel E. So votes green. Honorable Edison J. Wanika. Green. Honorable Edison J. Wanika votes green. Vice Chair, I vote of 5 in favor, 0 opposed.
Thank you very much, Delegate Yazzie, Representative Johnson, and Dr. I apologize, I don't have your name in front of me. Oh, Dr. May. Thank you.
Vice Chair and committee members, thank you very much. Thank you.
Absolutely. We'll move on to item D, this informational/update on family harmony, domestic violence shelter, Shiprock, New Mexico. We have an associate and the Division of Social Services.
Yes, this is Marlinda Littleman.
Hello, Ms. Littleman. Will you be providing the report?
Yes, thank you. Good afternoon, Mr. Chair and committee. My name is Marlinda Littleman, the Deputy Division Director. And adon ishleniki eya maidishkijni nishle. Izatlana bashishchin tedishkijni dashache adon nakaidin edashanale. I joined the social services team back in July and quickly jumped into all the operations of the division. Currently, Ms. Neswit Gishi, Deanna Neswit Gishi, she is attending 2 other meetings regarding the New Mexico Highland University and also with the Administration for Children and Families. So myself and our team members, Regina Yazzie and Trudy Sosi and Rayanne, I'm sorry, not Rayanne, Regina and Trudy will be assisting in providing the report this morning. And I will, if I may, give just a brief moment to have both of them introduce themselves. Regina.
Yes, hello, Mr. Chair and committee members. This is Regina Yazzie. I am the Department Manager for Department of Family Service. Ito na enshini itkapahin shlin hanagani bashishin tachini dashiche tondok ojidashional adotich indi da yesanasha ihaha.
Thank you, Regina. Trudy.
Good afternoon, committee members. My name is Trudy Sosi, and I am the Principal Victim Witness Advocate for the Family Harmony Program, Northern Treehouse Shelter. She'eya tohadlini and she oze tachi di bashichin kitlachini dashiche don't manage gini dashinella. And I am the shelter manager for the Northern Treehouse Shelter in Shreveport, New Mexico. First shelter operated by Navajo Nation. And thank you very much.
Thank you, Regina and Trudy. Back to you, Chairperson.
Thank you very much. So, Ms. Littleman, who is going to be providing the report?
And Regina Yazzie will be providing the report, and if there's additional information or clarification, she may yield the floor to Ms. Sosi. At this time, I'll give time to Ms. Regina Yazzie. Regina?
Thank you, committee members. Yes, so I emailed the written report to Angelita about 30 minutes ago about that time, so she should have it in her email. I'm just going to briefly go over the written report. So regarding the Family Harmony Program, which is a program that was developed October 1st, 2016, and it was renamed from Strengthening Families Program to Family Harmony Program in accordance to the plan of operations that was amended for the Division of Social Services. The Family Harmony Program is funded under the Administration for Children and Families, which is a grant with the Family Violence Prevention Services Act, also some funding under the Bureau of Indian Affairs 638. The Family Harmony Program has 4 victim advocate, witness advocate positions, 2 of which are vacant, and the 2 workers that we currently have are mobile advocates who work in the communities 24/7 providing victim services, which includes prevention education, crisis intervention, support services, court support services, life skills, and et cetera, regarding also referrals to outside resources. The Northern Tree House Shelter, the one located in Shiprock, is under the Division of Social Service, and the shelter itself is a 24-hour, 24/7 shelter service to victims and families, which again includes crisis intervention, support services, and victims of domestic violence and families such as dating violence and victims impacted by sexual trauma, result of sexual assault and or human trafficking. The shelter is a 5-bedroom with 4 11 beds. There are currently 3 full-time staff at the shelter with 4 vacant positions. And the vacant positions are residential caseworker positions. Ms. Trudy Sosi conducted interviews for those vacant positions recently and had selected 4 people. And of the 4, 2 of the applicants declined to continue their application process, while 2 of them are currently completing their criminal background check and will continue to be processed with our office and in partnership with Department of Personnel Management. So the shelter itself has currently has a 3-year lease agreement with Navajo Housing Authority, which expires on December 31st of this year. We are currently renewing the lease agreement, and it is currently going through the 164 review, and it is at the Office of Management and Budget and we're going to continue to get that processed as well. Some of the goals for the shelter include renewing the lease agreement by the end of the year, hire in the vacant positions, and continue with the 24/7 shelter services. Accomplishments include that not only have the shelter been able to provide from January to present to November, there were 188 total served by the shelter. I do have some statistics in the report as well. And also people sheltered, there were an overall total of 96 people in the shelter so far, which included 1,689 bed nights so far. And also services to non-sheltered included 87 adults. Crisis intervention calls received were 90, and referrals that were made out to other outside resources include housing, financial assistance, counseling services, and school referrals. A total of 33 referrals were issued. In addition to those accomplishments, Ms. Sosi has been and continued to attend monthly meetings, which included coordination, collaboration meetings with Northern Arizona Care and Services After Assault Coalition and the New Mexico Native Coalition. Mr. Chair, members of the committee, that is our brief update report. At this time, any questions for me at this time?
Thank you very much. Committee members, the chair is open to questions, comments. And Ms. Benali sent out the report at 12:09, so it should be in your email.
Presiding Chair, Vice Chair Slater, question.
You're recognized, Chair So.
Yes, thank you. Miss Littleman, Yazzie, and Ms. Sophie. So the report entails that there are vacancies within the staffing. How is the division and the program assisting in assuring that the clients that do reside at the shelter have the proper care and the proper staff coverage? Or the current staff having to work more hours to assure the 24/7 attendance? Presiding Chair, later, back to you.
Thank you, Chair So, and we'll go back to Ms. Littleman and Ms. Yazzie.
Thank you, Presiding Chair and members of the committee. This is Regina Yazzie. So at this time, with the shelter staff present currently at the shelter, there is sufficient coverage. As we had also reached out to our victim advocate worker out of the Crown Point service area to assist at the shelter until the positions, at least 2 of the positions are filled within the next, we're hoping within the next 30 days. So there is sufficient coverage at this time. Mr. Chair and Presiding, back to you.
Thank you very much. Committee members? Questions?
Follow-up, Honorable Vice Chair, Presiding Chair.
Yes, Chair So.
Yes, in the aspects, with our experience with the Mental Iron Hawk facility in Blanding, Utah, there was the referrals came from domestic violence victim advocates. Where do the referrals come from for the placement of clients within the this Family Harmony facility, the Northern Treehouse Shelter? Back to you, Presiding Chair.
Thank you very much, Chair So. Ms. Yavi?
Thank you, Mr. Chair and Presiding Chairperson Slater. The referrals are self-referrals. We get calls, the shelter gets calls, crises calls, referral calls, and they get referrals from the individual requesting the service themselves, or referrals from law enforcement, referrals from the local hospital, referrals from another shelter that may be outside the area as well. So referrals come from all areas. In terms of a specific breakdown of referrals, I will defer to Ms. Sosi, but to elaborate further. Ms. Sosi?
Thank you, Regina. Thank you, committee members, honorable chair. Well, due to the referrals that are coming into our Northern Treehouse crisis line, which is monitored 24/7, like Regina indicated, we do get self-referrals. We collaborate a lot locally with the local IHA's hospital, not just Shiprock, but also like Chinley, Fort Defiance, Gallup, Tuba City. So we get a lot of referrals from social workers, doctors, and we also get referrals from social services, not just the Navajo Nation, but also Farmington, CYFD. So we get referrals from them. And then not only that, family members would call and they would refer someone in the home that's being abused. And we usually do an intake and also do a follow-up on that as well. So we get referrals all the way around through our crisis, and we get it through email, fax, calling in, and even just someone mailing a referral in, accept that. But in the meantime, we are open, and anybody that's a victim of violence is who we assist. Thank you.
Thank you very much, Ms. Tosi. Committee members, do you have follow-up or further?
Follow-up, Vice Chair Slater.
Chair So?
Thank you. Committee members, Ms. Sosi, this question is to you. Regarding, I know that in prior months there was a report that there were COVID exposure among the staff and the client. How have you coped with that? Do you have enough supplies, PPEs, as well as the necessary cleaning supplies? And basically, do you have in-house laundry services where you can basically cope with the contamination, let's say, to the bedding supplies? Back to you, Vice Chair.
Ms. Tosi?
Thank you for the question. Thank you for the question, Honorable. So, okay, well, as far as coping with COVID-19 and the outbreak that we did encounter last year in October, from that point on, we've been best practice, closing our gate, screening our calls carefully with our clients that call in. We'll ask appropriate questions. We'll add on, like if you're sick, do you have a fever? Do you, any the symptoms if you're showing? And most of them will say, I got tested, I'm feeling sick, and then we'll have, my staff are trained to where if they hear something unusual, they have the COVID hotline here in Shiprock at the hospital. So we'll try to place our families there, or if they need other resources, we'll try to assist them in that way. But as far as practicing it in the shelter, we don't allow visitors in the shelter. I don't allow our clients going in and out of the shelter. There's sanitation, cleaning supplies. We have our little stations set up in shelters. As a shelter manager, I assure that we do have cleaning supplies available, hand sanitizers set up, soap set up, and then Clorox wipes. So we're doing best practice every day. When we're on shift, we sanitize the shelter, the furnitures, the clients the same way. I do have a protocol when they're admitted. We'll take their temperature, wash linens, wash their clothes, they take a shower. So we practice that when we get a new admission for a family. So that's been ongoing. But we do have enough PPEs. We've been getting support from executives. They've been giving us masks, gloves, hand sanitizers, Clorox. So that's an ongoing thing that we've been getting. And also our local chapter here in Shiprock has been really supportive with that as well. So they give us PPEs as well. In the meantime, as far as laundry, linens, we do have a laundry room set up. We do wash our linens. We sanitize it here on our own. I have staff that does that as well. And then not only that, is that's a part of life skills that we teach our clients, how the proper way to wash your linen, sanitize, especially with the COVID here in Navajo. I hope that answers your question, Chair.
Chair?
Thank you. Follow up. At any time of the day, what is the staffing level at the facility? Vice Chair Slater?
Thank you very much, Chair. So, Ms. Sosi?
Okay, any time of the day, the staffing, just like right now, it's myself, and I do have an advocate here, just like Ms. Regina indicated that we are utilizing Crown Point's victim advocate during the week. So she's here with me and she conducts the services during the day. And I do have 3 shifts that I assign my staff on. I have a morning, afternoon, and a graveyard shift. So those other 2 advocates from Shiprock, they're on either the evening shift or the night shift. So that's how the rotation shift works here in Shiprock. As a manager, one of my main duties is making sure those gaps of shifts are covered. Like if one of my staff have emergency and then I'm called to fill in those hours, that's how we keep the shelter operating. But the staffing is just every day is 2 plus our maintenance tech.
Chair, sir?
Yes, follow up. Ms. Sosi, are you an at-will employee? Vice Chair Slater?
Ms. Sosi?
Chair, so yes, I am. I'm an at-will employee, being a supervisor for one of the supervisors for the Northern Treehouse Shelter, and exempt employee as well.
Sure.
So you're telling me you're an employee that is under double jeopardy. That's just a comment of really, Ms. Sosi, I appreciate your willingness to serve our less fortunate citizens. And certainly from my seat on the committee, I really appreciate, like to express on behalf of the committee your willingness and the concerns that brings us to put this on the agenda is just the fact that, you know, we have experience with one of the staff members from Gentle Ironclaw having to drive 2 hours to this particular facility and then having to do the coverage, much like what is happening with the Crown Point folks. And 2 hours driving in, perhaps 4 hours at the facility, and then 2 hours driving back. That is a concern. And certainly it brings a red flag to the committee, and that's the reason that this line of questioning is being put in order as the committee moves forward in this regard. Please know that as with prior practice, we will at some point in time schedule a site visit to view for ourselves. It's interesting in this aspect, committee members, this was formerly a nonprofit domestic violence shelter, and then it became a Navajo Nation run domestic violence shelter. And that's another reason that we really need to basically make sure that the clients that come to the shelter are given adequate services. And the aspect of us having other domestic violence shelter advocates to help I guess wade through the court systems, whether it be with the San Juan County or the county jurisdiction for some of the clients of this particular shelter. Committee members, that would be the extent of my statement and question. Thank you. Back to you, Vice Chair Slater.
Thank you very much for the comments, Chair. So, committee members, are there other questions or comments on the report?
Vice Chair Slater, this is Delegate Charles Newton. Can you hear me?
Yes.
Vice Chair, I do have a question, if you will allow me.
I didn't hear any other committee members, so we'll recognize you, Delegate Charles Newton. Thank you.
Thank you, Vice Chair Slater. Otto, thank you for the questions, Chair. So it was very difficult to hear your questions, but I do want to ask specifically 2 questions. One is, as a delegate, I continue to get information from Navajo Nation employees asking if they are ever going to get paid hazard pay and special duty pay. And I know that we did in February pass legislation to increase funding for the executive branch, and in that is supposed to be payments made out for special duty and hazard pay. However, I know that I'm not the only delegate that gets these emails asking those questions. So what I would like is on the record if all of the employees have been paid their special duty pay and hazard pay. And I ask specifically for the women's shelter because I did read, I believe it was in the Daily Times last year, that Miss Trudy Sosi stayed with the victims there or the families there at the women's shelter after a family tested positive for COVID. And I know as a result of that, all of the employees there at the women's shelter tested positive for COVID. And they did take it home to their families. And as a result of that, families were, infected other people as well. So to me, that, is it's a job hazard. And so I did ask if they received hazard pay, and I know that some of the employees have stated that they haven't. So I'm putting this on the record because in February, when council debated the budget, we asked if all employees were included in that hazard pay and special duty pay. We were told yes. In addition to that, when we passed the budget, I did ask Dr. Jill Jim if all of the employees have received special duty pay and hazard pay, and I was told again that everyone did receive their special duty pay and hazard pay. And at that time, I know that Dr. Jill Jim said that a lot of employees are not really understanding the way special duty pay worked or hazard pay. However, I think that if we can pay our Department of Justice attorneys who sat behind closed doors during the pandemic, if we can pay them hazard pay, we can certainly pay our shelter employees who had direct contact with people during the time that COVID, was rampant on the nation, that we can pay them hazard pay as well. And I know that when I read that article on the Daily Times with what Trudy Sosi did there at the Shiprock shelter, she could have at any moment said that this job is not worth it and could have left. But she went above and beyond what was expected of her as a Navajo Nation employee and stayed with the families that needed help during that time, as well as other shelter employees. And I know that when I asked the employees if they received hazard pay, many of them looked at me very confused, and many of them stated that they did not receive hazard pay. So I want to get it on the record in front of the Oversight Committee. I would like to ask, were all the employees under your division in your department paid hazard pay and special duty pay per the law that was passed by council and per the budget that was approved by council to get our employees paid? That's my first question. My second question is I have been asking about the long-term plans of the shelter. And the reason why I was asking about the long-term plans is I am well aware of what happened with Gentle Ironhawk. We cannot afford for our shelters to be closed down or to be passed to another jurisdiction. And so I have asked, what is the status of the shelter? I know that we were told that originally the 5 Hogans was Division of Social Services was the one who owned those 5 Hogans, and they were planning to reopen it, but we learned that that's not the case, and that right now the shelter in Shiprock is operating under a lease that is supposed to be going out this year, and there has been absolutely no communication. I will say that again to the oversight. There has been no communication on the status of this lease. I have asked that question. I have asked Dwayne Wasita from NHA to sit down with Division of Social Services the women's shelter, myself and Delegate Crotty, to see what the status of this lease is and what we can do to possibly purchase the facility that they're in so that they can expand, because right now the lease does not allow them to do that. And this is my initial meeting with Dwayne Wasita, the acting CEO of NHA. And I know that he did state that there would be a meeting that he was actually going to be meeting with Division of Social Services, and he was going to be updating them. But I also know that I have sent emails that have gone unanswered regarding the lease. In addition to that, I think that there has to be better communication. Oversight Committee, I did have a meeting a couple of weeks ago with Speaker Staff, Division of Social Services, and that was the question that I asked, and I'm glad that Chair So asked that question regarding staff. I was told at that time that they were fully staffed, and later on there was some backpedaling that happened, and I was told that technically I think they only had 3 employees who were working there. I ran into Trudy Sosi at Bashes. I believe it was a couple of days after that meeting, and I did ask her if she has taken time off to heal because of COVID. And she said no, that they don't have the staff in place for her to take time off. And I did let her know that we did have a meeting and that it was stated that they were fully staffed. And then later on, I think the wording that was used was they were staffed enough to be able to do their job. But when you have your director who can't take time off to heal or even to be with family, that kind of tells you something that's going on. So I've been getting a lot of mixed information from Division of Social Services regarding the women's shelter. And I've also asked if there were any projects within the women's shelter that was included with the ARPA funding. And I haven't got a response back to that question yet. I have been asking a lot of our social service programs these questions regarding ARPA, because my understanding is, and I could be wrong on this, is many people were not consulted. It was projects that were already, created, and ideas that came from directors and mainly from Office of the President and Vice President. And I know that with the women's shelter, they are in need of expanding. They're in need of finding a permanent location. They are in need of more funding. And I think that right now we do have Ms. Trudy Sosi, who is on the line, and, perhaps she wants to say more, but as we all know, there's that word that gets thrown around all the time, retaliation. We see it, we hear it, we know it's there, and some of us, we acknowledge it. Some of us ignore it. But I believe that if we truly want to know whether the shelter is being fully funded, it should be a conversation that we should have with the boots on the ground, with the maintenance tech, with the staff, with Ms. Trudy Sosi herself. And what I would like to do is invite the Health, Education, Human Services Committee to the Shiprock Shelter, and also NHA and Division of Social Services to talk about this lease and this possibility of expanding. When I did one time stop by the shelter back in 2019, and that shelter was full. And I was told that they had to turn away some families because the shelter was full. So those are things that we do need assistance with. And again, if the shelter is going to stay there in the Shiprock community, I think we need a long-term plan that will detail, what the shelter, like how long the shelter is there and what the shelter needs really are, instead of, just giving them a budget and telling them to work with it. So again, 2 questions, 2 concerns, and then also an invitation to the Health, Education, Human Services to visit with the Shiprock shelter there so that we can get an idea of what is needed. Thank you.
Thank you very much, Delegate Charles. We'll go back to the program.
Yes, thank you, Delegate Charles Newton, for those questions, and committee members. Thank you. This is Regina Yazzie. To address question 1 regarding hazard duty and special duty pay for staff, the answer is yes. Under staff under Department of Family Services, who I'm speaking about, including shelter staff that receive their special and hazard duty pay payout. However, there were some back and forth between Office of the Controller and Department of Family Service at the time. This was earlier this year. Regarding some discrepancies and questions as to the forms that were submitted and paperwork that were submitted by the staff themselves. So those were submitted, and there were questions and discrepancies that were resolved with those staff members that needed further clarification. So with that, they were resubmitted and then approved. As of August of this year, I received word that all hazard duty pay, special duty pay documents requests were fully processed by the Office of Controller for Department of Family Service staff. However, with that stated, I will go back and reassess with Office of Controller to ensure that what I just reported is what actually happened, and if there were some that were still questionable, I need to be aware of those. I will go back to Office of Controller and address that. But as of right now, as of August, I was informed they were all processed and folks were paid out. The second question regarding long-term plans for the shelter. Delegate Charles Noon, I did provide my report earlier, and in my report I indicated the lease agreement that is being renewed by the end of this year. It is currently going through the 164 review at Office of Management and Budget. I believe it was on, your other question was regarding a meeting between NHA and Department of Family Service, which we did have. It was on October 26th with Mr. Dwayne, his name slips my mind, but with NHA director, we did have our meeting and we did address the lease agreement. We are in agreement that we are moving forward with that. And then regarding the future, we are in support. We are going to continue services with the shelter. And as I also mentioned earlier in my report, the funding source is through the Administration for Children and Families, as well as the 638 BIA funding. That's how the funding is distributed for the shelter itself. Other than that, those are my responses at this time, Mr. Chair and committee members. Back to you.
Hi, this is Marlinda. If I could also add to Ms. Yazzie's comments.
Yes, Marlinda, you're recognized.
Okay, thank you. Thank you, Delegate Charles Newton, for your question. I'll speak a little bit to your question number 2. First, I guess and foremost, Ms. Sosie's commitment is acknowledged, and we are working on a long-term plan with our staff And also, I wanted to touch up a little bit about the, although we're talking about the Northern Tree domestic violence, you did mention the 5 Hogan shelter. And what we had found out is there was an on-site visit by our staff in Shiprock regarding the 5 Hogan shelter, and instructions from our executive director at the time, this is a couple months ago, was to secure the facility and to work with facilities maintenance. We've contacted the facilities maintenance, and we were informed that the facility is not tagged, meaning for property management purposes. And then at the same time, simultaneously, we were working with Department of Justice and also Economic Development. And in coordinating with them, we found out that the facility is actually assigned to Division of Economic Development. And the only way that Division of Social Services could enter onto the premises or administer any operation is through an intra-governmental land use agreement. And so we did write a written request to Division of Economic Development expressing that we were interested in going into an intra-governmental land use agreement with Division of Economic Development for purposes of the 5 Hogan. But after we've reassessed our resources, we found that it would not be feasible for us to do the infrastructure part of the project. And therefore, we have since then relinquished our request to Division of Economic Development. There are other options, such as either other entities, such as Shiprock Chapter or Community Development, that could take on the infrastructure. And if the infrastructure is in place, then Division of Social Services can reconsider leasing the facility and going in there for the operation of a domestic violence shelter. So I just wanted to provide clarification. When we did meet with Mr. Wisetta from Navajo Housing Authority, we, in terms of purchasing the facility, with speaking specifically about the Northern Tree, the recommendation was that the facility is an older facility, and the recommendation was to, if we're going to put resources into purchasing a facility, it would be more beneficial if we would put the resources toward a new facility instead. So that was, when we did meet with Mr. Wisetta, that was one of the recommendations. And as Ms. Yazzie reported, in lieu of, continuing the, maybe that's not the correct word, but to continue the services, we are renewing the lease, which she did report that it's going through the 164 review process. And then your question about the ARPA, yeah, there are 3 projects that are identified, and one is with funding for telework for our division. Those are for purposes of teleworking, purchasing the equipment, And the other project is it's campus style facilities, because not only for Department of Family Services, but for our other programs under the division, we are lacking, our office spaces are limited. And so therefore, we're looking to increase the capacity for office spaces for our staffing. And then the other is for school clothing. So those are the three projects at this time. That's what we're working on in terms of the ARPA. So I just wanted to provide clarification in those. And also, as I recall, we do also have a meeting next Wednesday. I believe it's with Honorable Delegate Crotty, and also with Honorable Delegate Eugene Charles Newton, and also with the Speaker's office. So just wanted to also add that to our report. Thank you. Back to you, Vice Chair Slater.
Thank you very much, Ms. Littleman. Committee members, are there further questions or discussion? Going toward, well, actually, the chair will entertain a motion to accept the report. I don't think we've established that. A motion from Delegate Begay. Is there a second? Delegate Wanika? Delegate So or Lona? Second. We have a second from Delegate Wanika and a motion from Delegate Begay. Committee members, is there further questions or discussion on the report, item D? Going twice. Going three times. Mr. Mose, can you please do a roll call vote?
Yes, sir. Honorable Paul Begay Jr.
Delegate Begay votes green.
Paul Begay Jr. votes green. Honorable Purnell Halona. Honorable Purnell Halona. Honorable Charlene So. Honorable Charlene So. Honorable Daniel E. So. Honorable Daniel E. So. Honorable Edison J. Wanika. Honorable Edison J. Wanika votes green. Honorable So and Halona are still on mute.
Okay.
Honorable Charlene So and Honorable Purnell Halona. Star 6, please.
Can you hear me, Chair?
Now we can hear you.
Oh, I guess I was on mute there for a little while. Vote green.
Honorable Purnell Halona votes green. Honorable Charlene So. Vice Chair, a vote of 3 in favor, 0 opposed.
Mr. Chair, this is Angelita Benally. I received a text from Delegate Charlene So indicating she's voting green.
Okay, thank you.
Thank you, Ms. Benally.
Vice Chair, a vote of 4 in favor, 0 opposed.
Okay. Chair So, I think, is presenting legislation at the Resources and Development Committee. So he is excused for the moment. Thank you very much, Ms. Littleman, Ms. Yazzie, and Ms. Sosi for the presentation and the responses to the inquiries. So we'll move on to item E, report, update, family assistance services, COVID funeral assistance, administrative programmatic issues. Presenter Regina Yazzie, as well as Deanna Nesbitt-Kishi from the Division of Social Services. So, Ms. Littleman, I'll recognize you if you're still on the line. It sounds like you're standing in for Ms. Nezwagishi. Ms. Nezwagishi?
Yes, thank you. Thank you again, Vice President Slater. For this particular report, it will be provided by Rayanne Matiba. She is the newly program manager for Navajo Family Assistance Services. And I will give her some time to introduce herself. Rayanne.
You're recognized.
Good afternoon. Good afternoon, Mr. Chair, Vice Chair, and committee members. My name is Rayanne Matiba. Kia ani and shalom to the Chitni Bashachin Hatso Dasche Hunagatni Dashanella. I am, like Marlinda said, just recently applied for the Senior Program and Project Specialist position for Navajo Family Assistance Services. So I'll go ahead and give a brief report on that. I was the coming over from Department of Child Care and Development as the senior accountant. So that's pretty much a little small background of my experience here. Moving on.
Vice Chair Slater, with your approval, we can proceed with the report.
Yeah, just please continue with the report.
Thank you. Go ahead, Rayanne.
Okay. So I'm kind of piggyback off of the previous report sent in back in last month. Navajo Family Assistance Services provides general assistance, burial assistance, low-income home energy assistance, the school clothing and supplies, community service block grants, and we're now implementing the low-income household water and waste assistance program as well. Just a quick overview, my team currently consists of 8 permanent staff, myself as well as 2 other temporaries, so a total of 11 staff members. I apologize, I am very short staffed. We are working on filling all of our positions so that we can provide better services to our general public. With that, we have a total of about $28 million that we have budgeted for all of these programs. We are in the process of continuing to expend down as many funds as we can. Currently, we are also in the process of updating our technical software. We are using the JustWare software. We are also trying to implement the data port system with Eagle Sun under the TAS software. We are also doing manual processing for payments requests and working with OOC and OMB on those processes. We've recently fully expended the CARES Act LIHEAP funding to support the needed assistance to families for heating and cooling expenses. Unfortunately, we do have quite a bit of applications that were not processed because we had reached our funding limit. So just a quick overview on that. We are working with DOJ to continue to find other ways to fund these applications, and they would be our top priority. We do have the ARPA LIHEAP budget being set up. Once that is complete, then we'll go ahead and use that to cover the CARES Act applications that we have received back for any applications received prior to 9/30/2021. We are continuously working on school clothing and supplies entries. Again, unfortunately, I am very short staffed, so I do have about 4, including myself, as well as Diana Nezwagishi, that is entering payments into the TAS system. So we do have a very slow process going here. We also are working with other departments to help review and get these applications completed as quick as we can. With the COVID-19 virus, as we all know, the Navajo Nation was affected very hard by this virus. Many families have been requesting for assistance. We currently had to reach out into general services or general funds to help assist with those fundings. We have the 638 burial assistance. As of October 26, we assisted 267 affected families and provided financial assistance totaling $880,000. We also had the UUFB, which was the Navajo Nation COVID funds, and that was more open and not as restrictive as the 638. However, that funding did end on September 30th, 2021. So we had to revert to converting applications over into the 638 funds. If families did not meet those requirements, then Division of Social Services general funds were utilized to cover some of those requests. We do continue to receive COVID-19 requests out of the reservation area, and we are trying to work with what little funds we have to cover those types of requests. I understand that we did request to have a carryover. I am not sure if that is still something that is going to be reviewed and looked at, and whether or not we can go ahead and proceed with that. We have a total of $1.2 million available for CSBG related expenses. And we are working on the approved or the LIHEAP policy manual. We have a 5-year BIA Public Law 638 contract approved for general services and burial assistance, which began January 1st, 2021 and will end on December 31st, 2025. Recently, the Navajo Nation, our Navajo Department of Justice determined the General Assistance and Burial Assistance Policy Manual to be legally sufficient, and it was submitted to Delegates Daniel So and Otto So for sponsorship on December 9th, 2020. And at this point, the policy is still pending. That would complete my report. There are more details on the report that was submitted this morning by Rosalind.
Thank you very much. And yes, that report was sent out, I think, by Ms. Rosalind Begay. Let's see, 10:24 a.m. Committee members, if you need to check your email. We've heard the report. The chair will entertain a motion to accept the report.
Motion.
Motion from Delegate Begay. A second from Delegate Wanika. So committee members, the floor is open for questions and discussion on item E.
I have a question.
Delegate Begay, you're recognized.
Thank you, Vice Chair Slater. The Shade Up Chair. So, members of the committee, there seems to be just a lot of I guess you could call it complaints, or maybe kind of people are getting they get very upset when a person becomes deceased. And I'll tell you one thing that happened over the weekend, where we had another former delegate, a veteran, a public servant for many years, Jopagi Itza, Kea Hastine. And the family approached the chapter for assistance. And so when something like this happens, we basically have about 4 days to get things done. And yet, we give them the runaround. Halit ego atskins ko eya kodo peso be bakado watligi. Jotkinso. Patanota. Ado eya. The person editor, yes. No, Samacha Hundorni. It seems like it's just too many issues, and chapter level are some part of the problem. And this situation was where a chapter official said that the fund will be here, just come down and pick it up. The funding was only for $150. And so to start things off, as far as paying for expenses, this relative goes down to the chapter, and the chapter there informs them that there was a misunderstanding. There are no funds available. How can we get our loved ones that have become deceased, get these fundings that will help them, help the family, take care of their loved ones for funeral expenses? How can we take care of this for them in a quicker manner? They only have 4 days to take care of their loved ones, and they have to go to the mortuary. They have to make arrangements. They have to sit down, write eulogies. They have all these different things that they need to do. So, in the meantime, we're giving them the runaround. Hello. Okay. And there was another similar incident, and I got a text yesterday afternoon on that too. How can we expedite these funds for our loved ones quicker? If it's at the chapter level, it's just a thought that I'm sure a lot of people go through it there at the chapter level. How can family assistance services or funeral assistance services, how can social services help these people, these families, to arrange for their loved one, arrange for their funeral expenses a lot quicker without all these so-called red tape or whatever it is that hinders the process of planning for funeral service. Thank you, Vice Chair.
Thank you very much, Delegate Begay. We'll return to the program.
Thank you for that question, Delegate Begay. In response to your question and the complaints, first off, I just want to point out that we do not work with the chapter house. I am happy to hear that the chapter house is willing to help with what little funds they have, but currently we do have social workers at our designated sites that do assist families with up to $200 or $2,500 for regular burial assistance under the 638 funding, as well as $3,500 for COVID-related deaths. So it is unfortunate that this family did not receive the funds they needed. I would, however, recommend that they reach out to my staff, and we can move forward with getting them the assistance they need. With that, since we've had the issues with COVID-19 over the past couple of years, and our offices did have to close down direct service to the public, direct face-to-face interaction. We have worked with mortuaries to where the families will apply with the mortuaries, and from there, they will provide all the required documents needed. It will be forwarded over to my senior caseworkers. They will then determine eligibility and ensure that the family is being assisted and work with them in whatever other documents that are needed or can be substituted. And then they will immediately verify or confirm with the mortuary that they are approved for a certain amount. So that's how we've been working that. I do have a lot of burial assistance requests that come in on a daily basis, and my staff members are very quick about getting that situated prior to services, because what we've noticed is that the mortuaries will not continue with services until they get an approval from us as to how much we're going to pay for the remaining amounts. So that I hope that answers your question, Delegate Bouquet.
Thank you for your response. Thank you. Vice Chair.
Thank you very much, Delegate Begay and Ms. Mateba. Committee members, are there further comments or discussion items related to the Family Assistance Services Program? Going twice? Going 3 times? Mr. Mose, can you do a roll call vote on item B?
Yes, sir. Honorable Paul Begay Jr.
Delegate Begay votes green.
Honorable Paul Begay Jr. votes green. Honorable Pernell Valona.
Walmart green.
Honorable Pernell Valona votes green. Honorable Charlene So.
I vote green.
Honorable Charlene So votes green. Honorable Daniel Lee So. Honorable Edison J. Wanika.
Green.
Honorable Edison J. Wanika votes green. Vice Chair, a vote of 4 in favor, 0 opposed.
Thank you very much, Mr. Mose. We'll move on to item F. Update notice to Winter Rock District Court regarding WR-CV-25-20. Completion of notice filed to the Winter Rock District Court. And presenter Louis Millette, Harrison Rice, and Desiree Deschini. Let's see here. Do we have either Mr. Millette, Mr. Rice, or Ms. Deschini?
No, thank you, Mr. Vice Chair. This is Louis Millette.
Okay, and then do we have either Chad Aveda or Ms. Babra? Mr. Aveda, you're there?
Yes, Vice Chair, I'm here. I apologize. I was trying to look for the unmute button. Thank you.
Thank you. Okay, Mr. Millette, you're recognized for the presentation.
Thank you, Mr. Vice Chair, members of the committee, and guests on the line. Mr. Vice Chair, are we going to go into executive session for this?
I guess I'd ask you for some guidance real quick, and just to state for the record why you believe it makes sense, and then the committee can make a decision whether to resolve itself in executive session.
Thank you, sir. Just basically because it involves litigation strategy.
Okay. Thank you very much, Mr. Millette. Committee members, what is the wish of the committee? Motion. How long? An hour? Okay.
Whenever it gets done.
Okay. We have a motion from Delegate Wanika and a second from Delegate Begay to resolve ourselves into executive session for no longer than 1 hour. So if we finish up early, we can come back on the record with an appropriate vote. Committee members, is there discussion or questions? Going twice? Going 3 times? Mr. Mose, can you do a roll call?
Yes, sir. Honorable Paul Begay Jr.
Paul Begay votes green.
Paul Begay Jr. votes green. Honorable Pernell Halona. Honorable Pernell
Green.
Halona. Honorable Pernell Halona
Green.
votes green. Honorable Charlene So.
Green.
Honorable Charlene So votes green. Honorable Daniel E. So.
I vote green.
Honorable Daniel E. So votes green. Honorable Edison De Wanika.
Green.
Honorable Edison De Wanika votes green. Vice Chair, vote of 5 in favor, 0 opposed, into executive session at 1:17 p.m.
Okay, thank you. And I'm assuming that...
Honorable Slater, Melvin Harrison. I was trying to unmute myself, sir. Can you ask Mr. Millett if myself and Mr. Zoida Kelly, Executive Director for NEA, and our legal advisor, Mr. Ron Haven, can go into executive session as well?
Mr. Vice Chair, I can answer that if I may. We might have lost him.
Mr. Millett, you're recognized. Thank you.
Yes, sir. Thank you, sir. It's up to the committee, but I have no problem with it, sir.
Okay, I think we have a thumbs up in the room, but we'll need to be disciplined in our conversation. So, Ms. Benali, are you going to send out the executive session line, or do you have someone from the Speaker's office doing that?
Mr. Chair, I haven't, I believe that Tommy Sosi is on the line, but however, I'm generating another, I guess, Zoom meeting that I'll be sending out in a little while. I'm just afraid that if I start sending that one out, it'll end this meeting on my laptop.
Interesting.
So as soon as you
Tommy, are you there? Mr. Sosi? Well, you know, Ms. Benali, is it possible for you to send me the link and then I'll host it?
Okay, I think it's letting me send out the link right now, and then when we start the executive session, it'll end this the current meeting. Thank you.
Okay. Well, if you have a co-host for this meeting, which maybe could be Mr. Mose, then you wouldn't have to do that. Or I don't think it would automatically end it, but yeah, just go ahead and send out the executive session line and we'll worry about it when we get back on. Thank you.
Hello, can you guys hear me?
Yeah, I can hear you.
Hey. Hey. Yes, hey. Okay. We're talking.
Mr. Mose. Uh-oh.
Roll call, close to verify we got quorum for this portion of this meeting.
Yes, sir. Honorable Paul Begay Jr.
Elton Begay is here.
Thank you, sir. Honorable Pernell Halota.
Hello, Mr. President.
Thank you, sir. Honorable Carl Russell Slater.
He's
Honorable,
present.
Honorable Charlene So. Honorable Charlene So. Honorable Daniel E. So.
I'm present.
Sir, Honorable Edison De Monica. Here. Chair, we have 4 members constitute a quorum.
Thank you. Committee members, how do you wish to address that executive session? Well, I got the left on motion there. Yeah. Well, I guess we need to get out the first time, then we can make a decision. Like the motion to get out of executive session.
Second.
Motion by Honorable Edison Juanita to get out of executive session. Second by Honorable Vice Chair Carl Slater. No discussion. Roll call. Vote. Mr. Moore.
Yes, sir. Honorable Paul Begay Jr.
Green.
Honorable Paul Begay Jr. votes green. Honorable Pernell Halota.
Run with green.
Honorable Pernell Halota votes green. Honorable Carl Russell Slater.
Green.
Honorable Carl Russell Slater votes green. Honorable Charlene So.
I vote green.
Honorable Charlene So votes green. Honorable Edison De Monica. Green. Honorable Edison De Monica votes green. Chair vote of 5 in favor, 0 opposed. Exiting executive session at 2:38 p.m.
Thank you. Mr. Mose, I voted 5 in favor, 0 opposed. Chair not voting. We are out of executive session. Committee members, how do you wish to address the report, the update?
All motion to accept.
Motion.
Motion by Honorable Vice
Second,
Chair.
I don't know.
Second by Honorable Pernell Alona. Discussion? No discussion? Let's, Honorable Paul Gage calls for the vote. So, Mr. Mose.
Yes, sir. Honorable Paul Gay Jr.
Great.
Paul Gay Jr. votes green. Honorable Pernell Halona.
Hello, vote green.
Honorable Pernell Halona votes green. Honorable Carl Russell Slater.
Green.
Carl Russell Slater votes green. Honorable Charlene So. Honorable Charlene So. Honorable Edison J. Wanika.
Green.
Honorable Edison J. Wanika votes green. Honorable Charlene So. Chair, vote of 4 in favor, 0 opposed.
Thank you. Mr. Mose, let the record show 4 in favor, 0 opposed, 1 member not voting, and the chair not voting.
Hold on, sir.
Mr. Chair, this is Angelita Benally. I got a text from Delegate Charlene So that she votes green.
Okay. All right. Thank you. So there's a change in the vote to accept the report. The vote is 5 in favor, 0 opposed, and the chair not voting. Thank you, Mr. Millett. David Colorado, Mr. Ron, and the supporting attorneys, as well as Melvin Harrison 1. Thank you. Going on, old business, we go to new business, A, legislation 0195-21. Honorable Chair Charlene, no, excuse me, I'm sorry. Eugenia Charles Newton, are you on the call? And what? 3 times. So, legislation 0195, even though it's called to the table, and the sponsor is not present, so it will be automatically referred to the next regular meeting of TED on November 17th. We go to new business B, to to schedule a meeting request with Dr. Kurt Steinhaus, Secretary Mexico Public Education Department, and New Mexico Indian Education Assistant Secretary Lashana So, as well as Assistant Secretary Gwen Valeria Mornamet, and then Indian Affairs Department Secretary Lynn Trigger. Ms. Angelita Benali, could you provide some information regarding this particular agenda item?
Mr. Chair, this is Angelita Benally. I can barely hear you, but I think I made out that you're calling for 7B, scheduling a meeting request. Dr. Kurt Steinhaus, the New Mexico Secretary of Education with the New Mexico Public Education Department. And they have recommended a meeting on Thursday, November 18th from 3 to 5 p.m. in Santa Fe. And it will be held at the Jerry Apodaca Building, the Marbury Hall. And the agenda, their proposed agenda has Secretary Kurt Steinhaus presenting introductory remarks along with Secretary Lynn Trujillo of the Indian Affairs Department. And it'll go down to the next item would be the updates from New Mexico Public Education Department. And again, Secretary Steinhaus and Assistant Secretary So with the tribal consultation update. And next would be the update from the New Mexico Indian Affairs Department with Secretary Lynn Trujillo. And it allows for responses and questions. And at 4:40 would be updates from the Health, Education, and Human Services Committee with responses and questions. And the meeting is scheduled to end at 5 o'clock.
Yes, thank you. And I guess committee members, in response, let's talk about, and committee members, there's that proposed agenda in the packet. In that response, committee members, before we accept the invitation, I'd like to basically put in the agenda a response on the tribal framework, tribal remedy framework that the Nampikiaskit committee endorsed. That would be one item specific. And then the other is how we're proceeding on the certification of teachers, most specifically certification and extra pay for teachers that are certified to teach native language. That would be on our end, as well as the effort to address learning loss that we all know has occurred. That would be the items that, and the committee is certainly welcome to add other items, committee members.
So 3 to 5 on the 18th?
3 to 5 on the 18th. And the other is, if need be, we could basically ask for a separate meeting with Indian Affairs Secretary regarding the aspects of how to access the ARPA funds that were sent to New Mexico. Certainly somewhere around 80,000 Navajo registered voters and the participants in the census would enable us to access the ARPA funds, and possibly by that time we can also talk about the new infrastructure plan, because regarding roads, railroads, and bridges. And that may also include a report from Legislative Liaison Linnea Montoya, that is staff to the Senate Indian Affairs Committee.
This one, how to access ARPA funds on New Mexico. That will be really good to do with Arizona, because New Mexico area always includes us. But Arizona, that we should, I don't know, as many delegates should go down there for that one. Maybe schedule a meeting like that. They died, I see.
So, Ms. Angelita Benali, did you get the those additional items. Again, a separate letter or email to Secretary Lynn Trujillo. And possibly an earlier meeting. The only thing that really troubles us is the EFG is scheduling a Chaz over here, Ms. We have a NABI meeting on that same day. And it's a long agenda. So committee members, shall we ask for a different date?
We might have to, yeah.
At 18th, 19th, when that show?
I feel like we've moved around so many times for Navi. We have, remember the Wednesday special Navis? And then there's the other one, might just be making up, I don't know, but there was the other one.
So, okay.
I mean, do you know what the proposed agenda is? I guess what I want to know is if it's going to be controversial items or if it's just going to be pretty standard.
I saw a proposed agenda. It seems kind of long to me.
Yes.
But I don't have it in front of me.
I think there's 7 or 8 agenda items.
Yeah, and probably more to be added. There's a number of legislation that will hit by that time.
About the 24th, our regularly scheduled meeting happening there.
But on Monday morning, Emmanuel Rico sent out that a special meeting will be scheduled on November 18th. Now, and the agenda items are long, unless, of course, we designate the 17th for travel. We all convene to participate in audit. We'll leave it on the 18th. Okay. With that, committee members. And then, I guess the other part, Ms. Finale, Mr. Rico to also schedule a meeting with the Arizona Department of Education. With Ayla, motion? Motion. A motion by Honorable Paul Gay. Second by Honorable Edison Juanita Travel.
Travel 17th. Travel 17th.
Travel on the 17th. To be there on the 18th. Thank you, Mr. Moe. Ayla, committee members, anything else? Travel question. Mr. Moe, roll call vote.
Yes, sir. Honorable Paul Begay Jr. Honorable Paul Begay Jr. votes green. Honorable Pernell Halona. Honorable Pernell Halona. Honorable Colin Russell Slater.
Well, that's green.
Honorable Colin Russell Slater votes green. Honorable Pernell Halona votes green. Honorable Charlene So. Honorable Charlene So.
Start pumping iron, Rick.
Honorable Edison J. Wanika, green. Honorable Edison J. Wanika votes green. Honorable Charlene So.
I vote green.
Honorable Charlene So votes green. Chair, a vote of 5 in favor, 0 opposed.
Thank you. A vote of 5 in favor, 0 opposed, chair not voting. We go to item 7C. A meeting with the East North Bronx Community School. We do have a memo from.
Still working on it? Can you check with her on it? Because it's been here for
Yes, Mr. Chair.
months.
Pernell, mute your phone.
I don't even see that. I don't even
Okay.
Lawrence.
Yeah, I did, Mr. Chair, members of the Health Education and Services Committee, I initially did speak with, Dr. Russell. Katrina Russell, I believe is her name, she's the principal of the, she's not on community school. And at the time, she did indicate that there were no in-person meetings conducted, and it's, according to the IE, that there are no in-person meetings conducted on the school site. However, she did say that on the 9th, she wasn't available because she was meeting with the, school construction, the new school construction team. So I guess they were meeting in person there on the 9th at the district. But she did say that she was available on, she did indicate she was available on 16th to meet with Health. But that she would have to have that meeting approved by, Mr. Walter Coulter of the BIE headquarters, which is located in Winter Rock. And he, sent us a letter indicating that, it's addressed to the Health Committee. I've been made aware of the Health Education and Human Services Committee contacted Dr. Russell on November 4th, 2021, requesting that she appear before HEP. It is my understanding that this meeting is a continuation of HEP's attempt to schedule an on-site and virtual meeting regarding Central Community School personnel practices. It is my further understanding that a written complaint has not been submitted to the principal or to the IE management regarding this issue. As expressed in my September 29th, 2021 letter to HEP, you will be, if you would be willing to share the concern and the source of concern, I would be more than willing to investigate the issue. However, as Central Community School is a bureau-operated school, any investigation or resulting or resultant meeting regarding Central School personnel practices will be facilitated by the Bureau of Indian Education. Dr. Russell will not be attending the HEC meeting on November 9th, 2021. If you have any questions, please contact me. It's Dr. Walter Coulter, Acting Education Program Administrator, Navajo Bureau of Operating Schools, Arizona. And that's what was indicated. I believe that, as I understand, when I initially worked on scheduling the first meeting with Delegate Sherry So did indicate that she had information which she didn't share with me, but she said that that was what concerned her to initiate a request for the meeting between Tech and community school. But I don't know if, how this committee wants to proceed with this.
Can we hear from, Zoe Stowe?
Mr. President, Honorable Charlene So, how do you wish to proceed regarding that particular response?
She's muted. Star six, Honorable Stowe.
Star six, Mr. President.
So muted.
Oh, that's a quick. Between Walter Coulter and Kentucky. Ninja, that's a quick.
Encuentra sintiendo que yo pido yo
You proceed in that manner.
I'm sorry, what do you say?
To meet with Ms. Dr. Coulter and then Dr. Russell and then Ms. Arvizo.
I'd be happy with that, but I think we should review something in writing first, like they're saying.
Okay.
Because I don't want us to jump the gun, because everyone's gonna expect us to jump the gun. when there's an issue like this at the end. So just more precedent setting matter, I think, pushing.
Charlene, so that 0195, let's just turn it back in.
Phone is unmuted, Robert. Phone is not unmuted, Robert.
Or 6.
Which is it? It's not unmuted.
Huh?
Her phone's not muted.
It's not unmuted, she says.
And can you unmute it from your side? Just, so I can.
asked her to unmute it, but she has to unmute it.
Oh, because of my watching.
Well, here we go.
Oh, wish, Motion by Honorable Carl Slater to refer to the next meeting, this particular item 7C, regarding the West Community School to the next meeting, November 17th, or the next regular meeting, second by Honorable Paul Brigade. Question, discussion? If not,
Motion to adjourn.
then, we go to a vote.
We'll vote with the deferment first.
Yeah.
All right. Honorable Paul Begay Jr. Honorable Paul Begay Jr. votes green. Honorable Pernell Halona. Honorable Pernell Halona. Honorable Carl Russell Slater.
Green.
Honorable Carl Russell Slater votes green. Honorable Charlene So. Honorable Charlene So. Honorable Edison J. Wanika. Honorable Edison J. Wanika. Well, Chair, I voted 2 in favor, 0 opposed.
2
Mm-hmm.
with orange. Honorable Halona, are you on the call?
Both him and, Charlene So on mute. Honorable Halona. Okay, Honorable Charlene So votes green. Honorable Charlene So votes green. So the vote is 3 in favor, 0 opposed.
Okay, thank you. Committee members, a vote of 3 in favor and 0 opposed, the chair not voting. 2 committee members, connection. With that, that brings us to the conclusion of our today's adopted agenda. Motion by Honorable Carl Slater to adjourn. Second by Honorable Paul Begay. Motion to adjourn. Honorable Halona comes back and make to adjourn. Honorable Slater, Mr. Rose, roll call vote.
Yes, sir. Honorable Paul Begay Jr. Honorable Paul Begay Jr. votes green. Honorable Pernell Halona.
Green.
Honorable Pernell Halona votes green. Honorable Paul Russell Slater. Green. Honorable Paul Russell Slater votes green. Honorable Charlene So. Honorable Charlene So, she dropped off. Honorable Edison J. Wanika. Honorable Edison J. Wanika. Chair, your vote is 3 in favor, 0 opposed, adjourned at 3:08 p.m.
With this, committee members, I really forgot to bring up the Dr. Winsor's requested one, so we'll adjust it in the second one. Okay, we're adjourned. The vote of 4 in favor, 3 opposed, 3 in favor, 0 opposed, 2 not voting, chair not voting. We're adjourned. Everybody turn off your phone. Okay.